Good morning, and thank you for watching channel 167,543 Action News at 8:41 a.m. with your live action team of field reporters and co-anchors.
Good morning, I'm Larry, and thank you for watching channel 167,543 Action News at 8:41 a.m. I'm joined here by my tramp Russian mail order bride co-anchor Smirnoff and Newscast.
You paid for my visa, Larry. It's totally different. Hello, I'm Smirnoff Vankushka, and our headline story for this oddly timed news broadcast is a new press release about prenatal teratogen exposure, specifically the effects of tobacco on prenatal development, as well as postnatal effects. The new release has a target audience of women who are pregnant or planning to become pregnant. Back to you, Larry.
One contributing article to the study written by Dwyer, Brody, and Leslie outlined the effects of nicotine on prenatal brain development. Mothers who smoke while pregnant have been shown to have children with various birth defects stemming from prenatal nicotine exposure. Whether the nicotine be from smoking or nicotine replacement therapy, also known as a patch, these include alterations in sexual differentiation of the brain and in cell survival. Although, not only the constituent of tobacco smoke, there is now abundant evidence that nicotine is a neural teratogen. For more on this article, we now turn to our field reporter, Jean-Carlos Francois.
Thanks, Larry. Tell your wife Susan I said hello. Dwyer and his associates found that exposure to nicotine during early development will target the circuitry that matures the earliest, such as that found in the brainstem and midbrain. Later exposure may instead lead to behavioral deficits, more specific to planning and cognition. Nicotine is the primary reinforcing agent in cigarette smoke, is known to be neurotoxic, and can readily cross the placenta into the fetal serum and brain. Nicotine acts on acetylcholine receptors, which are cation channels that are widely distributed throughout the fetal nervous system. In addition to its impact on cell growth and development, low doses of prenatal nicotine, as low as 2 milligrams per kilogram per day, also produce changes in the synthesis of both adrenal and gonadal hormones. Lastly, nicotine usage increases fetal corticosterone, and this has been shown to specifically inhibit testosterone production in male fetal gonads. Back to you, Larry.
Ask your wife, Annalisa, where she was last night. We will now go to the field reporter, Iwanaki Timanoshi, for part 2 of the news release.
Thanks, Larry. Let me know if Susan is busy later. Did you know that smoking during pregnancy is presumably the cause for 15% of all premature births and a 150% increase in overall prenatal mortality? Because according to Hafiz de Jomstay and Merkis, it is. Exposure to cigarette smoke during pregnancy leads to a reduction in fetal breathing movements, which are essential for normal growth and structural maturation for fetal lungs. However, the effects of prenatal smoke exposure may play a greater role on lung function in childhood than postnatal development and childhood exposure to nicotine. Prenatal maternal smoking increases the risk for symptomatic pediatric asthma. Pregnant women who actively smoke are at high risk for resulting in a decrease in oxygen diffusion across the placenta. This contributes to a reduced birth weight and length and a smaller head circumference at birth. It is estimated that smoking during pregnancy reduces birth weight by 10 to 15 grams per cigarette smoked daily. A low birth weight correlates with an increase in the occurrence of coronary heart disease, stroke, hypertension, type 2 diabetes mellitus, insulin resistance, and serum lipids. Maternal smoking during pregnancy doubles the risk of sudden infant death syndrome, also known as SIDS. Possible reasons for the correlation between passive smoking and SIDS are abnormalities in brain development with a tendency to stop breathing repeatedly while sleeping and disturbed respiratory control mechanisms, including a reduced ventilator response to a shortage of oxygen reaching the tissues of the body. Back to you in the studio, Smirnoff.
Thank you, Iwanishi. In addition, Thompson, Levitt, and Stanwood found that many legal drugs, such as nicotine and alcohol, can produce more severe deficiencies in brain development than some illicit drugs, such as cocaine. However, erroneous and biased interpretations of the scientific literature often affect educational programs and even legal proceedings. For example, a pregnant woman whose emergency toxicology screen revealed cocaine use could potentially be jailed and accused of using a deadly weapon against her unborn child. Such policy decisions may have unintended consequences. For example, the legal proceedings may harm the the fetus through pathophysiological activation of the maternal stress response. A case study in 1985 reporting damaging effects of cocaine use during pregnancy produced a massive media response. Based on the media reports, laws were enacted in the United States requiring healthcare professionals to report illicit drug users to child welfare authorities, and legislation was pursued to make drug use during pregnancy a criminal offense. Moreover, the threat of criminal punishment can foster fear and mistrust between doctors and their patients, increase maternal stress, and endanger the health of women and their future children. Based on the science, one could argue that this is considerably worse than the drug exposure itself.
And that's all for our newscast this morning. For everyone here, I'm Larry signing off. Stay admirable, College Park.